H- Hi everyone. Once again, welcome to Weekend Wellness. This is Series 6. Like I said earlier before, like the intention of this program is to educate people while we are on quarantine, and also, going further, we'll see if, we can use the same platform for education every weekend. So today's topic is maintaining good bowel and bladder function, and it's presented by Dr. Casey Smith. Casey Smith is a board certified women's health specialist. She's a physical therapist, and she's been teaching also in VCU, and she's been training, VCU undergrads and grad students from physical therapy. And she is one of the colleague, I could say, like, who is nearby. So, if you guys have any questions or anything, please free to contact her. We'll provide her information, and Dr. Cora Hewitt, who is the owner of Women's Health PT and Men's Pelvic Health, she's also here with us. So thank you, ladies, for your support. One of my, the reason I wanted to present this topic is I'm always, interested in helping out. A lot of questions are asked by women. I try to explain, but I think coming from you guys, it's going to be more important because you have done a lot of research on this topic. So here you go, Dr. Casey. You can go ahead and present it.
Thank you. And thanks everybody for joining. I'm going to talk kind of generally about maintaining good bowel and bladder function, especially as we're dealing with something that is very unfamiliar to most people. We're in an environment that's very unfamiliar. And this presentation is not really geared at people who are experiencing or have experienced coronavirus, although there is some evidence of some GI problems that a certain segment of people have presented with before the respiratory problems. This is going to be more geared for all the rest of us that are either, working more, working less, providing care to someone, self-isolating, and dealing with everything that comes with that. So generally, I'm going to talk about the pelvic floor muscles and the muscles in your trunk and how that contributes to bowel and bladder function. But what I have here is a whole list of symptoms that may be related to a dysfunction in the pelvic floor muscles that people may or may not be aware of. And that includes urinary leakage, back pain, pelvic organ prolapse, constipation or other GI issues, maybe sexual dysfunction in men and women, pelvic pain, abdominal pain or dysfunction, and maybe even loss of balance. So although this is going to be targeted towards bowel and bladder, just want everybody to know that there are some other symptoms that you may have or may have had or know someone who has that may indicate that something is not functioning in your pelvic floor muscles. So when we talk about it, what is a pelvic floor? So I have a male and a female diagrammed here, and the arrows are pointing to kind of the red area, which is where your pelvic floor muscles sit. So they're inside the bowl of your pelvis, and it's more than just one layer there. This is a very simplified diagram, and they're essentially the same on male and female. But what they do is they have functions to support your organs and hold everything up, support your posture and your breathing, reproductive function in females, and really have a lot to do with the control of your bowel and bladder and sexual function. So when we look at the inside, this is a female pelvis, and we're looking from the top down. So you can see your big pelvic bones on the side. On the bottom of the picture is a cross section of vertebrae. And then in the front is the pubic bone. And all the red parts in between are different pelvic floor muscles. So there are multiple layers of muscles, and there's some that function in the front, and they're fast twitch muscles, which they're sort of like your sprinting muscles that help with urinary control. And then the deeper muscles, more towards the sides and the back, those are going to kind of do everything else, give you a lot of support and really support your breath and your posture and the organ functions. So that's the area that we're talking about and working with. Now, it's important to know that the pelvic floor muscles don't work by themselves. They work in a pressure system with other deep muscles in your trunk. And all those components need to be working well for your pelvic floor to really do its job and be strong and healthy. So on the left, we have a diagram showing those pieces. In the front is your transverse abdominis. That's the deepest layer of abdominal muscles you have. The diaphragm is on the top, really functions mostly in your breathing. Along the vertebrae in the back, you have deep muscles that are multifidi, and then the pelvic floor muscles are all in the bowl of your pelvis on the bottom. Now, I like to think about those things for an easy explanation, kind of like a soda can, where if you have a can that's intact and closed and there are no holes, it's very hard to manipulate it or compress it or, you know, damage it in some way. However, if you put a hole in it or you open the top, all of a sudden the liquid leaks out. You can crush the can from the sides, you can crush it from the front, so you get some dysfunction. So in a simplified way, that's how I like to think about this pressure system that's happening in your body. So if any one of those areas or more is not functioning, you're going to have a problem somewhere. So the picture on the right basically shows the action of how those muscles work together in a good way and a bad way. When you draw in your abdominals or draw in the pelvic floor, the opposite should come in as well, and it should be normal breath. If you hold your breath or push the abdomen out or something else, you're going to have a change in that pressure system. Holding the breath often puts more pressure into the pelvis. So that's also when people bear down to go to the bathroom, straining, often people are holding their breath, and it creates a different sort of tension. So these muscles sometimes are hard for people to visualize because you don't really see them on the outside. Everything you see on the outside are really your global muscles. These deep trunk muscles are underneath everything else in your body. And so to exercise them is sometimes a little bit tough because they're not that easy to find, especially if you've had some dysfunction. So I'm going to show you, kind of talk you through how to find them, and maybe you can incorporate this in what you're doing every day. Just so you have some sense of where those muscles are so you can stay strong and healthy and keep your trunk doing what it needs to. Now, when we talk about the pelvic floor, people think about Kegels, and really there are two kinds of Kegels. The front muscles in the that are like your sprinting muscles that hold back urine. We call those quick flicks in our clinic. So if you sit here and kind of squeeze the muscles in the front of your pelvis like you are holding back urine, that's really what you're going to be getting. Now, if you think about it a little bit farther back, maybe the area just in front of your anus, right between your two sitting bones, you're going to get to some of your deeper muscles. And those are your endurance muscles. Those support your posture. Now, it's important to coordinate those with your exhale. So if you take an inhale first and exhale, you contract those muscles in the deep pelvic floor like you're holding back gas or a bowel movement. That is what you're going to be getting there with those long holds. So those are your two kinds of Kegels. Now, not everybody needs Kegels. There are conditions of tension where the issue is not necessarily weakness. So you don't need to be doing contractions of those muscles to improve the strength. You need to be relaxing and lengthening those muscles. And so what I like to think about, I'm actually going to I'm going to stop this for a second and see if you can get into my screen. So if everybody, if you go onto the speaker view, you can maximize the screen there and just see me here. And I'll show you how I like to teach the reverse kegels as well. So I like to think about if you inhale into the belly, you're lengthening, you can feel the pelvic floor sort of lengthening underneath you. So if you take the inhale here, expand the belly a little bit, imagine the pelvic bones separating or dropping towards your feet. That's really where you are going to get the reverse kegel or the lengthening. So then we go back into the abdomen to find that transverse abdominis. So this is taught by a lot of people a lot of different ways. But what I like to do is sort of imagine that when you pull that muscle in, it's very soft and gentle, and you're not tightening all the abdominal muscles. So you kind of want to imagine the belly is hollowing out. So what you can do is put a hand on your abdomen and take an inhale first. And as you exhale, gently pull the belly button in towards your spine. And it almost kind of feels like something's zippering up from your pelvis up to your rib cage. So when you look at it from the side, the abdomen just kind of comes in and hollows out. Now with all of this, the breath is important because the diaphragm is the top of the box. So anytime you are exercising or doing anything physical, it doesn't even need to be exercise. It could be pushing open a heavy door. It could be picking up a child. It could be moving a couch, whatever it is, mowing the lawn, whatever it is that you're doing, you want to be breathing. And a lot of people make the mistake of holding their breath, or it may not be like hold your breath. It might be a big gap between your inhale and your exhale. So you might take an inhale, then push the thing, and then exhale. That's still a form of breath holding. So you want to make sure that you are gently exhaling through the movement. So when we look at this is, again, a female pelvis. And we're looking at the pelvic floor on the bottom. So under the column, under the picture that says strong pelvic floor, you can see that the band of muscles is thicker. It's lifted up more, and it's really supporting the bladder, the uterus, and the rectum in their place anatomically where they should be. If you look at the picture on the left, you see a pelvic floor that is thinner, that is lower and kind of sagging in the middle. And this, again, is a general representation. But what that leads to when it's weaker is those organs can sink down into the pelvis, and people can have pressure, heaviness, or have urinary leakage, have difficulty getting their bowels out. They might get stuck. So having a weakening through there really changes how everything functions. Now, I've kind of generalized some symptoms into people who have sort of a weak, thinned out, not very fit pelvic floor, and people who have a pelvic floor that is too tight. Now, again, I've put 2 asterisks next to it because every time somebody has a diagnosis, it's really based on the whole person and the evaluation. And somebody might have a different condition that they're dealing with causing the same symptom that isn't a pelvic floor problem or isn't a pelvic floor condition. So take these as kind of a general guideline, but they may not be exactly in the column that I've put them in for making it simple today. So when we look at people who have sort of a weaker pelvic floor, where the muscles just aren't as robust and healthy as they need to be and not as strong, those people might experience urinary leakage when they exercise or when they cough. maybe fecal leakage. And that can be, whether a little bit is coming out or whether people are losing their whole bowels. You can also have pelvic pressure or heaviness, which is often related to a pelvic organ prolapse, but isn't always. And you see this a lot in women who just had a baby, or maybe post-menopause, where the hormones have changed and the tissues have thinned out, or in males post-prostate surgery, or any kind of surgery where the muscles have just shut down. You also see it in people with a decreased fitness level, because if they're weak everywhere, the pelvic floor is going to be no exception. Then when we go over to tighter pelvic floor muscles, this might cause problems like urge urinary incontinence or frequency or retention. And what that means is kind of having a sense like you always have to go to the bathroom. People often describe it as they're out and about and they go home and try to stick the key in the door, and all of a sudden they've got to go to the bathroom for no apparent reason. It might also relate to constipation or some kind of pelvic pain. People who have other conditions like IBS or endometriosis or scar tissue or interstitial cystitis, those people might also, due to the inflammatory nature of their condition, have tension or tightness in the pelvic floor. So the people on the weak side usually tend to need strengthening and more of those Kegels, and the people in the tightening tend to need more of the relaxation and the reverse Kegels. Now, getting into how this applies to all of us right now. We are living in a time of increased stress and increased fear, perhaps, and that leads to a lot of different emotions, depending on any one person's situation. And your urinary and GI functions are definitely affected by your mental and your physical health. So all those emotions and all those mental processes and the change in your routine is definitely going to have some impact. Now, how much of impact that is variable, probably person to person. But we do know that stress creates a lot of body changes that do impact your urinary and GI function. And basically what happens is if you are experiencing some type of stress or anxiety or fear or some other intense emotion, your sympathetic nervous system turns on and kind of goes into hyperdrive. And that is your fight or flight system. So I know most people have heard that term, but basically you produce a lot of hormones to kind of get your body ready to do something. So it's a very upregulated kind of a position to be in. Most people aren't like that every day, all day, on a normal basis. Some people are, but most people aren't. But I feel like with all the people and patients I've talked to recently, everyone seems to be in this sort of upregulated nervous system type of mentality. And what happens there is, due to the changing hormones, the blood gets shunted away from your organs and goes into other parts of your body so it could be ready to act. So your digestion might be delayed, or the digestive secretions that you need to move through food through the body aren't there to break down that food, so it may sit there for longer. So some people may have cramping or inflammation in their abdomen, or the constipation or diarrhea even. It can go either way due to the stress reaction and the decreased blood flow into the organs. Stress also manifests itself in the body. Most people will tell you they feel, when they get stressed, they feel tension in their neck or their hips or back or somewhere. So a lot of people are probably carrying around a lot more tension than they would normally. And it may be in your, typical areas, but it may not be. It might be in the pelvis, it might be in the hips, it may be in the back or the abdomen. A lot of times with these type of emotions, people will get a lot of tension right along the midline under the rib cage. So right under that sternal bone that comes through the center, right under there, there's a place where we as humans collect anxiety. And it will sit there until it gets released. And it also inhibits, when the sympathetic system is turned on, it inhibits or turns off the parasympathetic system, which is responsible for your rest and relaxation and digestion and all those other things that happen. So it's very hard to have both be active. Now, some other things that play into it are also that piece that goes with a change in routine. So you may be in an environment you're not used to, or maybe you're not moving as much or moving in a different way than normal. So lack of movement may lead to constipation because you're not getting as much of your organ gliding, you're not getting as much blood flow going through your body. And it might also lead to tension in the back or the hips or the pelvis, which can definitely impact your urinary and bowel systems. Anxiety does a lot of things. It can increase urinary or fecal urgency and frequency, and it may increase incontinence and IBS systems. It may also increase breath holding, which contributes to decreased oxygen and increased tension in places. I've talked to a lot of people who don't consider themselves breath holders, but they find themselves during COVID just sitting quietly holding their breath, and they weren't even aware of it until they started paying attention. And so if you're holding breath not only to do something physical, but also just to sit quietly and live your life, you're going to have a lot more tension building up in some other part of your body. Boredom. This may increase trips to the bathroom. So this isn't everybody, but it's a certain amount of people right now who are stuck at home and don't have the socialization and aren't going to work or whatever the situation is. And they may go to the bathroom more often, which leads to more urinary dysfunction over time. Nutrition is also a big one. Again, if people are eating out less or their habits are different, that's going to change the consistency of the stool. Also, the type of foods may trigger some kind of urinary or bowel irritation or inflammation. So that's another arm of what we're talking about here. So what can you do about it? In general, movement is going to be better than non-movement. So what I would recommend is trying to at least take 2 to 3 short walks a day if you can. Now this can be like 10 or 20 minutes, it can be longer if you want. Ideally, you'd have some big chunk of concise time to do some kind of cardiovascular exercise just to keep your heart and lungs healthy and keep that blood flow going. But that's not necessarily going to help you if you're sitting the rest of the day. So having it kind of broken up throughout the day is also a useful strategy. It also helps combat that mental fatigue and mental stress that everybody is feeling right now. Stretching is also useful, especially for relieving the tension, the anxiety, helping that pelvic floor relax. That sort of helps with urinary retention and constipation. So I'll go over some specific stretches in a minute. Keep your trunk muscles active. So those exercises we did earlier, pulling in your transverse abdominis, contracting or relaxing the pelvic floor, breathing, all of those things are good. Keeping good posture. I'm not really going to go into posture in this presentation because Dr. Riemke already had a presentation on that. Which you can reference back to, but posture is very important too in keeping those trunk muscles strong and active. Don't hold your breath, and we'll get into some stretches. All right, so I've put up some pictures here, and if you access the PowerPoint later, you can see these, but basically they're all targeted at stretching through the hips, the back, and the pelvis. Now, there's plenty of other things you could do for your trunk to keep mobile, or your shoulders, or your calf muscles, or anything else for your body. But I'm just going to go through a few of these that are that are more of my favorites and show you how to do them. So I'm going to stop that for a minute. You can put it on the speaker view. All right, so I have my mat back here. All right, so this first one is the happy baby stretch. Now it's borrowed from yoga, but this is a really nice pose to kind of open up your hips and really open up the pelvis. You don't have to be a pro at it, and you don't have to be into yoga. You can modify it in some way, but it's really nice to just open everything up. So I'm going to lay down and I'm going to grab my feet on the insides here. Okay, so you can try that. Now, if you're very tight and this position is not accessible for you, you can hold your legs back here behind the thighs, or you can also put one leg down and do one at a time. So those are some modified ways to get into that. But if you can get into this whole position and just breathe here for 30 to 60 seconds or so, or as long as you want, you can really feel some nice things opening up. Now, another one that's important, especially if people are sitting a lot more, working from home, anything where you're in more of a crunched up position, is opening up the hip flexors in the front of the pelvis here. So if you come into a kind of a lunge position, you're really trying to open up this leg that is down. So I usually tell people to scoop in their transverse abdominals and make sure the pelvis is vertical so you feel it before changing the position for something more aggressive. You don't ever want to lunge forward where this knee goes out past the toes. So get your abs in and your posture correct first. And if you need something lesser, you can come into more of like a standing position here. If you need something greater, you can put a towel or something under this back knee or back foot, or you can take the front foot farther out and go into a deeper stretch through here. You just want to make sure that your abs are engaged, your pelvis is not tilting forward. Okay. Now the piriformis is another muscle back here that will get tight if you're sitting a lot, or if your back is feeling tight. It's a nice way to kind of loosen some things around the pelvis and the back. You basically make a figure four with your legs. So you can do it in sitting, you can do it laying down. I'm going to show it to you laying down. So I'm just going to take one leg here and I'm going to cross my foot over the other leg. So this may be a stretch for some people, or it may not be. If you need something more aggressive, you can bring this bottom leg up. You can change the position of this top leg, going towards your opposite shoulder, pushing it out, depending on what feels tight. But you'll feel the stretch kind of in the buttocks of the leg that's crossed over. So those are some of my favorite ones, but again, you'll have the PowerPoint to see some other ones. Okay, then we come to bathroom habits. So most of my patients never have any idea that they were using the bathroom incorrectly or had any idea that there were actually bathroom habits you should have. So basically for urinary conditions, you want to be hydrated. If your urine is not dilute enough, you're gonna have more irritation in the bladder, and you're gonna have to go to the bathroom a lot more often. You really want to get kind of on a schedule where you're going every few hours, but not more frequently than that. So You want to kind of get rid of the just in case trips to the bathroom. Like, oh, I'm walking outside. Let me go to the bathroom before I go, even though I just went 30 minutes ago. That will keep your bladder and your messaging system from your brain to your bladder working well. The other thing is relaxing on the toilet. You don't ever want to push out your urine or push out your stool. You don't want to strain anything. That weakens your pelvic floor muscles, and it also kind of makes them tighter. And it's a lot harder to get everything out. It's meant to relax. So you can just sit and breathe, calm yourself down, read a book, whatever it is. Do some reverse Kegels. Those are better strategies of getting your urine or stool out. Sometimes you can even massage the abdomen and it will help. Now, on the diagram is a proper toileting posture. In this country, we have these throne toilets that do not put us in optimal posture to go to the bathroom and evacuate what we need to. So the healthier option is to put a stool or squatty potty under the toilet so that it changes your anorectal angle so things will come out a little more easily, a little more naturally. But again, you want to relax while you're there. Do not sit on a high toilet. Easier said than done. Nutrition. So I mentioned this earlier, but this is very important for both your bladder and bowel function. There are known bladder irritants, mainly caffeine, alcohol, carbonation, sugar, tomato-based foods, and some fruits. Processed foods and sugar may also cause inflammation in the bowels. So if you are having problems, this is a good place to start in cutting those things out. Or, maybe cutting down to 1 cup of coffee instead of 4, or, whatever it is. Fiber and magnesium, these are essential in having a healthy gut. There are, now the amount of them is going to vary depending on if you're a male or a female and what kind of issues you might or might not be having. So finding the optimal amount is sometimes hard, but the foods I have listed here, flaxseed, chia seeds, bananas, apples, green vegetables, leafy green vegetables, those are things that are all good for your gut. For constipation, you might want foods that are easier to break down. Liquid foods are often easier to break down, so if you replace 1 meal a day with something liquid, that might help. For more of the diarrhea or the fecal incontinence, you might want foods that are more bulking the stool. Or if you're going to have a salad that is a lot of leafy green vegetables, maybe eat it with some rice or something that it will bind to so it doesn't just come right out. Hydration is super important, and probiotics may also help balance the flora in the gut and keep the pH of your gut more alkaline, which is an ideal situation. Then the relaxation of the nervous system part. This is often related to the mental health, but it's also the physical health. That nervous system really affects what we're doing and who we are as people. Meditation is a really good thing. I've listed some apps on here that I like and that are very common and easy to access, and they have some free parts, but also some paid parts. Even if it's 10 minutes a day, and even if you're not good at it, it is useful. It is a skill that you have to build up. But this is very good if you feel very anxious or stressed, or you're having urinary problems or bowel problems. A lot of times this will kind of calm the nervous system and let you get back to a normal balance. Go outside and lay on the grass. Connecting with nature is huge in that mental health piece. Take your shoes off and just lay down and feel the earth, feel the grass. Art projects. There's also a lot of online counseling, especially that's available now that maybe people didn't have access to before, but it's available now because nobody's going anywhere. Support groups function the same way. You can also sit quietly and do breathing for 10 minutes. There are apps that will take you through breath exercises. Very useful. And then lastly, maybe an abdominal or a back massage. I like to take a little ball sometimes, like a tennis ball or a toy ball works fine. And you can kind of go through the abdomen in a clockwise motion, just very gently. And that will kind of give you a nice abdominal massage. You can go a little harder if it feels tense, but gentle works. You can also take a little ball, put it in the small of your back on either side of your spine and massage it in there, roll it, or this upper middle part of your back here, where those nerve roots exit that control your nervous system. Sometimes just working through the tissues or a gentle massage there will help with your nervous system also. So again, you don't have to do all of this, but taking bits and pieces are useful and, you know, might help you, even if you're not currently having problems, you know, it's just going to help balance your nervous system and make your gut healthier just for living life, and prevent some of these problems from happening. And that's the end.
Thank you, Dr. Casey Smith. That
You're
was
welcome.
excellent. Everyone, if you have any questions, this is the right time to ask her. I think she went in detail about all the exercise that you could do, the stretches that you could do at home and everything. So feel free to ask her any questions.
Yeah, if anybody wants to ask over the chat, I can turn that feature on too.
Yes. 1 second. Your information is shared right there. So once again, Dr. Casey Smith is from, she's currently practicing at Women's Health, PT and Men's Pelvic Health. It's located on Brimo Road. And Dr. Hewitt is the practice owner. Thank you so much for both your time. So I'm just waiting for some questions. Meanwhile,
I have a question. I have a question or a comment. Casey, I do know, I've even had a friend, unfortunately, who has had COVID, and he had tremendous diarrhea. And this is apparently typical in about 12 to 15% of the people that have had COVID, that they have lots of diarrhea. And to the point that it's just, they're not absorbing anything. And your comments that you gave were so good. And I really appreciate that, because when people get to that point, and he also was vomiting as well. And when you're vomiting and have such increased pressure, of course, then you're leaking and, oh my goodness, it's many problems combined into one. So thank you very much for your comments.
Thank you. So while I'm waiting for other questions, regarding next week, we have Dr. Arun Kumar presenting from London. He's going to talk on a topic called Keep on Running. So he's going to present us with some tips for exercise, importance of exercise for running, thereby preventing injuries and everything. So do log in. It's going to be very interesting, especially he's going to talk about runners of all kinds, from amateur to the most experienced runners. So if you can log in, that'll be awesome. So I don't see any questions so far.
Very thorough.
Yes.
Thank you.
Any questions, anyone? So I don't see any chats coming up either. So.
Yeah.
Guys, all these presentations will be there on Facebook tomorrow. And hopefully, some of the stretches, keep doing those stretches because they're very good. They're very important, like Dr. Casey mentioned. So the interesting fact, Dr. Casey, is, some of my friends, the most important question they ask me is, why can we go out for a walk or run right now, So like, please do. It's very important right now than any other time to prevent any kind of, things happening to you, because they're worried about air transporting the COVID-19. I'm like, the virus, yeah, it's already there. It's just that if you don't breathe, if you don't walk, you're going to cause more trouble because your body is going to be easily absorbing it instead of fighting it.
Right. You won't have as good of immune system to fight it, or respiratory
Exactly.
system. Yeah, no, it's very important. And just, wear a mask, cover your face. And if,
Keep
I
going.
mean, I do it every day. And if I see people on the sidewalk, I will literally walk through someone else's yard or walk into the street to avoid passing people directly.
Directly, yeah.
But it's very important both for physical and mental health and to fight COVID.
Exactly. The problem is it's the media guiding them in a different way for everything. I mean, the group of runners I was even talking about next week, one of them even asked me, can I go for a run now? I'm like, please do. You've been running for a long time. Please do
Don't
run.
go with your group. Just
Yeah,
go by yourself.
don't go with the group. Yeah, exactly. Just go for the run by yourself. That's it,
Right. Use your group virtually.
Yes.
Also with walking and running, it's very important for people to expand their chest, because I see sometimes people are outside and they're very reticent and looking around. They have their body very closed, and just taking your arms up over your head and then coming back down and breathing and expanding your ribs is very important.
Very important
in
right
respiratory function.
Yep. So I think that's about it. I'm going to thank you once again, Dr. Casey.
Well, thank you
And
for
thank you,
organizing.
Dr. Kora, for your time. And like I said, I'll post this tomorrow. And stay tuned for next week. It's at 3:30 Eastern time. It's not at 4 o'clock. The presenter is from London, so he wants it at a certain time. So I'm just trying to, do that. And also the presenter for Sunday is going to be for sports injuries. So if you have any small kids or anybody who likes to participate in a sport, he's going to talk about, all kind of stretches, warm-ups and everything, conditioning your body. So that's on Sunday at 1:30 p.m. So next week, the timing has changed. It's not 4 o'clock. It's at 1:30, and it's at 1:30 on Sunday and 3:30 on Saturday. So he's actually a therapist who works for a sports team. So I'm trying to get him in. So it's going to be an interesting topic on both days. So
Very good.
thank you so much. Thank you all for your time. Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye.